Hello, and welcome to the Joint Commission Resources Quality and Safety Network Accreditation Update. I'm your host, Gail Garbarino. Suicide is now the 10th leading cause of death in the United States. And although the vast majority of suicides occur outside of healthcare facilities, many suicides occur within. Since publishing Sentinel Event Alert Issue 7, Inpatient Suicides, Recommendations for Prevention, the Joint Commission has worked with healthcare organizations on conducting extensive risk assessments to help make their healthcare environment safer and to prevent suicides. Despite these efforts, suicides continue to occur within healthcare settings. In fact, over the last 5 years, approximately 85 suicides per year were reported as sentinel events to the Joint Commission. As healthcare organizations and accrediting bodies intensify efforts to make the healthcare environment safer, it is critical to use available data and expert opinion to have clear guidelines on what constitutes serious environmental hazards and what mitigation strategies are acceptable in those situations when all potential hazards cannot be removed. Over the last year, there have been several specific situations where surveyors for the Joint Commission and/or state agencies have disagreed on what constitutes a ligature risk and what mitigation strategies are acceptable. To address this issue and provide guidance to customers and surveyors on what constitutes adequate safeguards to prevent suicide, the Joint Commission assembled an expert panel with representatives from provider organizations, experts in suicide prevention and design of behavioral health care facilities, Joint Commission surveyors and staff, and representatives from the Centers for Medicare and Medicaid Services. Through this expert panel, a formal consensus process was used to develop the following recommendations. First, inpatient psychiatric units in both psychiatric hospitals and general acute care settings must be ligature resistant in the following areas: patient rooms, patient bathrooms, corridors, common patient care areas. In inpatient psychiatric units in both psychiatric hospitals and general acute care settings, the doors between patient rooms and hallways must contain ligature-resistant hardware, which includes, but may not be limited to, hinges, handles, and locking mechanisms. In inpatient psychiatric units in both psychiatric hospitals and general acute care settings, healthcare organizations should not be required to have risk mitigation devices installed to decrease the chance that the top of a corridor door will be used as a ligature attachment point. In inpatient psychiatric units in both psychiatric hospitals and general acute care settings, the transition zone between patient rooms and patient bathrooms must be ligature-free or ligature-resistant. In inpatient psychiatric units in both psychiatric hospitals and general acute care settings, patient rooms and bathrooms must have a solid ceiling. In inpatient psychiatric units in both psychiatric hospitals and general acute care settings, drop ceilings can be used in hallways and common patient care areas as long as all aspects of the hallway are fully visible to staff and there are no objects that patients could easily use to climb up to the drop ceiling, remove a panel, and gain access to ligature risk points in the space above the drop ceiling. In inpatient psychiatric units in both psychiatric hospitals and general acute care settings, medical needs and the patient's risk for suicide should be carefully assessed and balanced to determine the optimal type of patient bed utilized to meet both medical and psychiatric needs. For patients who require medical beds with ligature points, there must be appropriate mitigation plans and safety precautions in place. And standard toilet seats with a hinged seat and lid are not a significant risk for suicide attempts or self-harm. They should not be cited during surveys and do not need to be noted on a risk assessment. For a complete detailed list of these and other expert panel recommendations, please refer to the latest issue of the Joint Commission's Perspectives. Now, stay tuned for today's JCR QSN program.